Arrow-headed worms of dogs and cats. The arrow-headed worms of dogs and cats include two members from the genus Toxocara, Toxocara canis and Toxocara cati, and one from the genus Toxascaris, Toxascaris leonina. They belong in the family Toxocaridae and are commonly known as arrow-headed worms because their cervical alae make their heads look like arrows, with Toxocara cati having a wider cervical alae than Toxocara canis, whereas Toxascaris leonina has a more lanceolate shape to theirs. From their names, you can tell that Toxocara canis affects dogs, and Toxocara cati affects cats. Toxascaris leonina is seen in both dogs and cats, and they may also affect wild carnivores. This video will focus more heavily on Toxocara canis, with comparisons with Toxocara cati and Toxascaris leonina inserted here and there. When a pup ingests an embryonated Toxocara egg, the egg travels through the digestive tract and hatches in the small intestines. Some of the larvae may proceed with their development in the gastrointestinal tract, whereas some can penetrate the intestinal mucosa and undergo what is known as tracheal migration, where they go into the bloodstream and travel to the lungs. They may also do somatic migration, where they travel to other tissues like the liver, kidney, muscles, and various connective tissues. In severe infections, this may cause verminous pneumonia in the lungs. Ascites and fatty degeneration of the liver can occur, and granulomas in the cortex of the kidney containing larvae may be seen. Continuing on, the larvae from the lungs are then coughed up and swallowed, and they grow up to be adult egg-producing worms in the small intestines, where the eggs are released into the feces. They parasitize the small intestines and the pup may experience stunted growth and loss of condition, having a dull coat and pot belly appearance. They may also have diarrhea with mucus. This can be very bad for young pups. In older dogs, when the larvae undergo somatic migration, they go into a hypobiotic state. This is a state of arrested development where the larvae do not need to move or eat because their metabolism is slowed. But when the dog gets pregnant, the immunity of the bitch is suppressed. The hypobiotic larvae wake up and migrate towards the placenta to the developing fetus. Most puppies are infected before they are even born. Some also travel towards the mammary glands, where they can infect the puppies shortly after they are born through the colostrum and milk. The larvae may also continue their usual life cycle and eggs are released through the feces. In other animals, somatic migration and arrested development occurs, except that nothing can get them out of their arrested development until they are eaten by dogs or cats, the natural host of the parasite. So don't let your pets eat that dead rat or something. Consequently, these animals are known as the paratenic hosts of the parasite. Other animals here also include people. Most of the time, it's asymptomatic, and nothing happens. But rarely, humans can develop a condition known as visceral larva migrans. From the name, this is the disease that occurs when the larvae are migrating through the viscera of the body. The human can experience fever, malaise, and chronic eosinophilia, because eosinophils are involved in the immune response towards parasites. Immunoglobulin E would also be increased. They may also experience abdominal pain and hepatomegaly, and sometimes the lungs are involved. When the larvae migrate towards the eye, this is known as ocular larva migrans. Kinda gross and may lead to blindness. So, Toxocara cati behaves similarly, except that transplacental transmission does not occur. And transmammary transmission occurs only when the pregnant queen was infected during late gestation. With Toxascaris leonina, it stays in the gastrointestinal tract throughout its life cycle. Thus, there is no transplacental nor transmammary transmission. Diagnosis is by detection of eggs in feces. Toxocara eggs are round and have pitted surfaces, whereas Toxascaris eggs are oval and much more smooth. Treatment. Given the transplacental and transmammary transmission of these worms, newborn puppies and kittens are assumed to be infected, which is why they are routinely dewormed starting 2 weeks of age, and every 2 weeks thereafter until the puppy or kitten is 3 months old, after which they may receive preventative medication in combination with other drugs that target other parasites. There are a plethora of deworming products with combinations of various drugs that target other parasites. Ask your veterinarian which one is right for your pet. So, to summarize, the arrow-headed worms of dogs and cats include Toxocara canis, Toxocara cati, and Toxascaris leonina. Dogs and cats are infected by peroral, transplacental, and transmammary transmission. In people, they can cause conditions known as visceral larva migrans and ocular larva migrans. Diagnosis is based on the detection of eggs in feces. Deworming with anthelminthic medications is done to treat and control these parasites.